While being told this devastating news, you also learn the horrific side effects that are associated with your illness. Death with Dignity offers you to make life-ending decisions so that you do not have to endure that suffering. Through my extensive research on Death with Dignity, I feel like I can offer you enough insight to give you a compelling argument to support Death with Dignity. We are all going to die. There's nothing we can do. However, if we be faced with a terminal illness, we can. I hope to persuade you today not to necessarily want to utilize Death with Dignity, but to open your mind so that this right isn't taken away from those who wish to use it. For one, you can't just have cancer and want to die. There are criteria that you have to follow. For one, you have to be 18 years of age. You have to be a resident of Oregon, Vermont, or Washington, capable of making and communicating healthcare decisions for yourself. You have to be diagnosed with a terminal illness that will lead to death within 6 months, and 2 doctors must determine whether or not this criteria has been met. Along with criteria, there's a timeline that must be followed. For one, you have to make an oral request to your doctor, wait 15 days, make a second request to your doctor, followed by a written request, wait 48 hours, and then you can pick up your medication at the pharmacy. Individuals now have the ability to die on their own terms, not those that lay before them due to their illness. New York State Senator Diane Savino told MSNBC, the option to end one's suffering when facing the final stages of terminal illness should be a basic human right, not dependent upon one's zip code. Brittany Maynard's husband, Danny Diaz, told MSNBC, it enabled my wife to focus on living her last days to the fullest rather than living in fear of dying in agony from her terminal brain cancer. Now we can look at the individuals who are advocating or are terminally ill and hoping this law comes to their state. This is not something that's for everybody, and it's not being forced to anyone who doesn't wish to use it, but it's being taken away from those who do. Brittany Maynard had to move from her home in California to Oregon so that she could die peacefully and on her own terms. Chrissy O'Donnell is a terminally ill California patient who is pleading with lawmakers so she doesn't have to move. She states, we have the right to live peacefully and die peacefully in the states we've chosen to live the rest of our lives. They're not asking for anyone to utilize the law. They're just asking for it to be passed so that they can die in the states in which they have chosen to live. In addition to those who are using the medication, there are those who are not. Not everybody that receives this medicine is going to take it. Sometimes they change their mind and sometimes they lose the ability to follow through. According to New York Times, Sarah Myers is 60 and she has Lou Gehrig's disease. She states, knowing you have the choice means you don't have to use it. In 2014 in Oregon, 155 lethal prescriptions were received. Out of those, only 105 were used. In Washington, 173 prescriptions were given out. 159 people are known to have died. 119 from the medication, 26 without having ingested, and 14 remain unknown. Ethan Rimmel is a psychologist and a cancer patient who wrote for a blog, Psychology Today. He states, I have not decided if or when I will use it, but it gives me great relief to know that I have some control over my dying. Meanwhile, there are those who do not think Death with Dignity should be legal and instead look for end-of-life care. People have argued that instead of taking the lethal dose of medication, the individual should receive palliative care. What is palliative care? It's specialized care for people with serious illnesses. It focuses on providing patients with relief for symptoms and stress of a serious illness. The goal is to improve the quality of life according to getpalliativecare.org. Dr. Quill, interviewed by the New York Times, is head of University of Rochester Medical Center. He speaks of a patient who was receiving palliative care to advance bone cancer. He stopped eating or drinking. Dr. Quill recalls it took him 10 days to die. You have to be incredibly disciplined to do that. There are many reasons the individual choose Death with Dignity over palliative care. According to Daily Mail, 36% of terminally ill patients voiced concerns about the doctor not being able to control their pain. 61% state they want to die because they are afraid of being a burden on family, friends, and caregivers. On the other hand, there are those that look at Death with Dignity as suicide. Many people do view it as the easy way out. However, those who are wanting to take the medication, they don't feel suicidal. Vermont Senator Claire Ayers states on governing.com, it was pointed out that you don't have to use the option to still die with dignity. But this is not suicide. This is a desperate act done by people who don't want to live. These people are already dying, and they are simply trying to control the circumstances of their death. Governing.com states that 70% of Americans support allowing doctors to end terminally ill patients' life by some painless means. Those who are dying and want the legal dose of medication want the topic to be talked about. Ethan Rimmel states, "It would be done to spare myself and my loved ones unnecessary suffering." I think it is important to talk about this because I think there is still some stigma associated with choosing to end one's life, even under these circumstances. I fully understand that death with dignity is not something that should be taken lightly, and it is emotional to talk about. I cannot in good conscience say it is something that we should take away from those who are suffering and do not want to live the rest of their days like this. The circumstances surrounding our death are often out of our control, and other times they aren't. I urge you to not want to take someone's final lifestyle choice away from them. Should I ever be in this situation, I do not want to have to put my family, my children, or any of you through unnecessary suffering and watch me die a painful, debilitating death. We can never say how we will react with being in this situation until we are, but it is not up to us to tell someone else that they should have to suffer. Brittany Maynard ended her own life on November 1st in Oregon after moving from California, but before that she stated, "I do not want to die, but I am dying, and I do want to die on my own terms."